Today we're going to discuss an important but often overlooked condition called mesenteric ischemia. This is a serious problem that can affect blood flow to your intestines and cause significant health concerns. By the end of this video, you'll understand what mesenteric ischemia is, its risk factors, the symptoms to watch out for, how it's diagnosed, how it's managed, and importantly, how to prevent it. Whether you're here because you or a loved one might be affected, or you're just interested in learning, you're in the right place. Mesenteric ischemia happens when there's reduced or blocked blood flow in the intestines. This can affect both the small intestine and sometimes the large intestine. The condition can come on suddenly, which is called acute mesenteric ischemia, or it can develop slowly over time, known as chronic mesenteric ischemia. Both types are serious, but acute mesenteric ischemia is a true medical emergency that requires immediate care. Let's start by understanding the factors that increase your risk of developing mesenteric ischemia. This condition doesn't happen out of nowhere. Rather, it often arises in people with certain underlying health issues. Older adults, particularly those over the age of 60, are more likely to develop this condition because as we age, our blood vessels become more prone to narrowing and hardening. People with heart problems such as atrial fibrillation, heart failure, or other cardiovascular diseases are at increased risk as well because blood clots that form in the heart can break loose and travel to the mesenteric arteries, blocking blood flow. High blood pressure and high cholesterol also play a role by contributing to the buildup of plaque in the arteries, a condition known as atherosclerosis. This narrowing of the arteries can gradually limit blood flow to the intestines and lead to chronic symptoms or even sudden blockage. Diabetes is another important risk factor since it damages blood vessels over time, making them more likely to develop blockages. Smoking is a well-known contributor because it damages the inner lining of blood vessels and speeds up the process of atherosclerosis. People who are obese or lead a sedentary lifestyle also face a higher risk, as these factors can worsen other conditions like diabetes and high blood pressure. Finally, certain drugs like cocaine can cause blood vessels to constrict or spasm, leading to ischemia. Now that we've talked about risk factors, let's discuss what symptoms might indicate mesenteric ischemia. The symptoms can vary depending on whether the condition is acute or chronic. In acute mesenteric ischemia, symptoms usually come on suddenly and can be quite severe. People often experience intense abdominal pain that seems out of proportion to how their abdomen feels when examined. This means the pain might be extremely severe, even though the belly may not be tender to the touch. Nausea and vomiting are also common, along with diarrhea or an urgent need to have a bowel movement. As the condition progresses, there may be blood in the stool, which is a very concerning sign. In more advanced cases, fever and chills can develop, indicating possible infection or tissue death. In contrast, chronic mesenteric ischemia develops slowly and presents differently. People with this form often experience abdominal pain after eating, usually described as crampy or dull in nature. This pain is caused by increased blood demand from the intestines during digestion, which can't be met if the arteries are narrowed. As a result, people may become afraid to eat because of the pain, leading to unintended weight loss. Other symptoms may include bloating, a feeling of fullness, and sometimes nausea and vomiting. If you or someone you know has these symptoms, especially sudden, severe abdominal pain, it's crucial to seek medical help immediately. Early diagnosis can make a big difference in outcomes. Diagnosing mesenteric ischemia usually begins with a thorough medical history and physical exam. The doctor will ask questions about the timing, nature, and triggers of the pain, as well as any other risk factors you might have. Imaging plays a key role in diagnosis. One of the most important tests is CT angiography, which provides detailed pictures of the blood vessels in your abdomen. This test helps identify blockages, narrowing, or other abnormalities in the mesenteric arteries. Sometimes an ultrasound or an MRI may also be used, depending on the situation and available resources. Blood tests can provide supportive information, though they're not specific. They can help identify signs of infection, dehydration, or metabolic disturbances that often accompany this condition. In certain cases, an endoscopy might be recommended to look inside the intestines, though it's not usually the first-line test for diagnosing mesenteric ischemia itself. Once a diagnosis is made, the next step is to manage the condition. Management depends on whether the ischemia is acute or chronic. In acute mesenteric ischemia, immediate treatment is essential because of the risk of bowel tissue death. This often involves emergency surgery to remove the blockage and any damaged intestinal tissue. In some cases, doctors may use a technique called angioplasty, where a small balloon is inserted into the artery and inflated to open it up. Sometimes a stent, a small mesh tube, may be placed to keep the artery open. Medications are also an important part of treatment. Blood thinners or anticoagulants help prevent further clot formation. Antibiotics may be given if there is a risk of infection. Fluids and other supportive measures help stabilize the patient before and after surgery. Chronic mesenteric ischemia is typically managed more conservatively at first. Lifestyle changes are crucial. Adopting a healthy diet, increasing physical activity, and quitting smoking can all help improve blood vessel health. Medications to control blood pressure, cholesterol, and diabetes are also key components. If these measures aren't enough and symptoms persist, then surgical or interventional procedures like angioplasty and stenting may be considered to restore adequate blood flow to the intestines. I just want to take a moment to ask that you hit that like button and subscribe to my channel. Leave a comment below if you have any questions or topics you want covered in future videos. Anyway, prevention of mesenteric ischemia focuses on controlling the underlying risk factors that contribute to the poor blood flow. Eating a balanced diet that's low in saturated fats and refined carbohydrates while rich in fruits, vegetables, and whole grains can help reduce cholesterol levels and improve overall vascular health. Regular exercise not only helps control weight, but also improves circulation and heart health. Quitting smoking is perhaps one of the most effective ways to prevent vascular damage. Smoking accelerates the process of atherosclerosis and can lead to numerous other health problems. Managing chronic conditions like high blood pressure, diabetes, and high cholesterol is equally important. Regular checkups with your healthcare provider can help identify these issues early and allow for prompt treatment. Mesenteric ischemia is a serious condition, but by understanding the risk factors and symptoms and by seeking medical care early, you can significantly improve the chances of a positive outcome. Prevention plays a big role too, and adopting a healthy lifestyle can reduce your risk. Thank you for watching. As always, take care of yourself and make the most of your day.